Okay, we're going to go ahead and do some tear trough filler with our specialized microcannula technique on this very lovely lady. The first thing we do is, after we discuss with the patient exactly what the target is and which side needs a bit more and which side needs a bit less, the first thing we do is we put some little droplets of local anesthetic, which allows you to use the cannula in a very pain-free way, but it also reduces bruising because the anesthetic has a little bit of epinephrine or adrenaline in it. So we put a few little drops. And we strategically position these drops to give us the right angles on where we're going to put the filler. And one more drop over here. Okay, then we have the patient put their hand up against there, just put a little bit of gentle pressure down and flatten your hand out. We're going to do a tear trough injection. And this lovely lady, years ago, about 5 years ago, had her initial tear trough injection. And you'll see those before and after pictures there at the end of the video. And you'll see 5 years ago, the difference between that and now. And the punchline is, this area here already looks tons better than it was 5 years ago. And 5 years older, right? So what we're doing today is mostly maintenance. It's already in pretty good shape, but we're going to make sure that it stays that way. Where we injected the local. This is the Restylane L. It's the correct filler to put in this area.
How does it feel for you? You feel anything?
I don't feel anything.
It's a critical thing about the microcannula. You're able to not just reduce bruising, but it's also, with this technique, this micro droplet local anesthetic technique before you do the work with the cannula, it makes it so much more comfortable. Fillers really don't need to be this difficult, challenging procedure to do. Again, there is a little bit of sensation here and there. We're not suggesting that it's just zero, but it's not a negative experience for patients at all. So we're just distributing it here into this lateral part of the tear trough. As we age, there's just sort of generalized loss of volume that sets in. It's a normal part of aging, especially for somebody who, exercises like this wonderful patient, works out, stays in shape. So many of our patients come in and say that they're so thankful that they exercise and work out, and it's great in terms of staying toned, but in terms of volume, now we're going to go after the lateral tear trough. Real nuance and subtlety can be achieved, if you know what to look for. It's not just about filling the areas that are just obviously sunken in or troughed. The young female face has a certain softness and curvature to it, and the idea, especially when using this microcannula technique, is to restore some of the roundness, you could say. Roundness may not be quite the right word, but the softness of
It's
a woman's
smoother.
face.
It looks smoother, and
Exactly.
It's not crepey.
That's a great way to put it. So you can see now we've gotten back to where we want to be. Super smooth, zero bruising, perfectly comfortable, all good. Okay, hold this right here. So there's the little entry port, the needle, and then we go in with the microcannula right here like this. we're just volumizing those areas. She had a tear trough injection about a year ago. So certain areas start to again show a little bit of deficit. So here we are again working on the lateral tear trough, filling in those subtle areas of volume loss. Just like the other side, no evidence of bruising. Nicely rejuvenated. We tip her back just a little bit for this lateral part. Everything's about getting the right angles. Injectors in the United States shy away from certain areas of fillers. They're a little bit shy about doing the tear trough because they understand it requires a little bit more skill level. But I really do think that they're missing the boat. It really allows, enables patients to get a comprehensive rejuvenation when combined with other areas, the standard areas here in the cheeks and the nasolabial fold, combining this with Botox and Dysport. It allows really remarkable results. And again, you'll see in the before and after pictures, you can look at this wonderful lady 5 years ago, right? We've all gotten a little bit older in 5 years, everybody knows that. But she looks very significantly better than she did 5 years ago. And that's without surgery, that's just with well done, elegantly done, fillers and Botox and Dysport. Okay, that's...
All right, go ahead.
Hi. The reason I started coming is I had 22 years in the house with surgeries, taking care of my mom, and I was just completely beat down after her death. I looked it. So I heard about Dr.Leong, and the reason I came here is he just does faces. I didn't want to go somewhere where they did everything else. I wanted someone that could just make me look refreshed. So I did Trough and I did Botox, and I couldn't believe the difference. I felt lifted. It kind of changed my personality because I'd been so depressed. I noticed I joined a gym. I noticed I started going out more. And honestly, it changed my whole perspective. I was ready to move forward. So I'm very thankful that I found him, and I've been continuing to come like once a year, sometimes every 6 months. And I notice now I'm the party girl. So I'm really appreciative of Dr. Leong, and I love his staff. So, okay, we just finished. For me, down the road, I'm 63, I'm getting older, I would love a facelift. It is expensive, but it's still a goal of mine. But until then, this is so much, it's cost effective. I look so much younger. And when I look at people, I always look at their eyes. So I notice bags, creepy skin, and look, I don't have that now. So I feel I look better now than I did 5 years ago. And I look healthier, and I'm not wearing glasses to hide. My husband always said that. He says, "Why are you hiding? You're beautiful." No, I was very insecure. So I feel more confident. The pain level is, I didn't feel any pain. Maybe you feel one pinch, but it's worth every cent, and it's very cost effective. So if I were you, I would definitely come here because you'll feel better about yourself, and you'll love Dr. Leong.